Hello folks, this is David Papa, the personal injury guru, and today I am bringing back Dr. Regab from CSI. He is a spine specialist, orthopedic surgeon, and what he's going to be doing today is talking about a couple of issues that we didn't get to last time, which is a more detailed event of what happens when he does his surgeries. Specifically, of course, to the neck, which is the cervical area, and the lumbar, of course, which is the lower back area. And we're even going to talk a little bit about why you don't want thoracic surgery, and if you do, all the complications that are involved in that. So we're going to be talking to him and getting that information from him. Of course, CSI is located right here in Clearwater, and he is an excellent surgeon. I've known him for a long time. I send a lot of people that are my clients to him that have become his patients, and we get rave reviews. And it's very important that you know when you come to me, these are the types of people I work with. Only people that I would go to myself or send my family to. So it's very important. If you have an automobile accident or a slip and fall, don't be afraid to contact me, and we'll be happy to send you to the right people and get you better. So without further ado, it is the Personal Injury Guru Show. Coming next.
This is the Personal Injury Guru Show with attorney David Papa.
Back to the Personal Injury Guru, and I'm David Papa, and today I have my guest, Dr. Regab from CSI. How you doing, Doc?
Good. How are you, Dave?
Good. And Doc's been on this show before, and the reason I brought him back today was because I want to be able to help everyone out there who has heard now. He was talking about surgeries last time on the cervical, thoracic, and the lumbar region. But today I would like a little bit more details about what you would expect to do in these types of surgeries. And if you can explain with detail all of these surgeries, how you perform them, whether people are awake or asleep, that sort of thing, just so people have a better understanding and they're educated on what these procedures really entail.
Correct, yes.
So let's start with the cervical. I mean, I'll kind of lead you along, I guess. I know that there's laminectomies.
Correct.
And that there are ACDF surgeries.
Correct.
And what are the types of neck surgeries you typically perform?
So before talking about the type of surgeries, we need to talk about why the patient needs the surgery.
Absolutely.
And like we said last time when we did this podcast, surgery is always the last option. We try, even though I'm a surgeon, we try as much as we can to avoid surgery and to help the patient with either injections or physical therapy or chiropractic treatments, which is all great. Because even if you go through all those and they don't work, and if they don't work, then you need surgery, you haven't burnt any bridges. So it's all safe. Once you have surgery, then you're adding scar tissue to the spine, which or you're doing a fusion surgery, which you cannot reverse. So all these injections or the therapy or the chiropractic treatments, they're all safe. But not everybody responds to them. The majority of people do respond to them. And if you're younger, you have a better healing potential than older people. So if it comes to surgery, and it's probably maybe only 10% that will require surgery, then we look at the surgery, seeing why the patient needs surgery. So if a patient herniated a disc and is pinching on the nerve, we just cut away the disc that's pinching on the nerve, just the portion of the disc. We don't take the whole disc out, just the portion that's pinching on the nerve.
Okay, can we talk about that for a minute?
Yeah, absolutely.
Okay, when you're talking about that, and I know that there's discs, and you've already described what the disc is and where they're located, but talk a little bit about what types of instruments you use and how you go inside to do this type of work.
Okay, so if we're talking about the cervical, which is the neck, there's two approaches. We either go from the front or from the back of the neck. We try to avoid the back of the neck because there's a lot of muscle there, and to get down to the spine, there's muscle cutting, and it develops scar. If you go from the front, which people don't really like because psychologically it's not fun to have someone have a cut in their neck. So people sort of cringe away, but it's much safer than going from the back because even though there's the carotid, the esophagus, the trachea, all that, it's a very safe surgery because there's no cutting muscles or at all. There's hardly any scar that develops, and we get down to the spine within 10 minutes, 5-10 minutes, and we're there. and then we can start the procedure. So if somebody has a disc herniation, we will take the disc out, and we either replace it with an artificial disc, which is made out of titanium and plastic, or we fuse that segment if the patient has a lot of arthritis in the back of his neck. So older patients get the fusion. Younger patients, we maintain the motion by putting an artificial disc in.
Okay, and as far as an artificial disc, I've heard about them. I don't know too much about artificial discs. I know about the bone cadaver bones that they use.
Right,
And
right.
can you kind of talk about those a little bit?
Right. So the two procedures are either a bone fusion, which or a spine fusion, which you use the cadaver bone, or the artificial disc. The advantage of the artificial disc, it maintains the motion. If you get to the point where you need to fuse, you're taking the motion away. And over time, that motion will go to the level above or below, and over time, those levels will degenerate and break down, and then you need another surgery. And there's a lot of studies that have proven that. But if you maintain that motion, a patient has a lot of arthritis in the back of their neck, their pain is not going to get better. They'll continue with neck pain. Younger patients that don't have arthritis, the artificial disc is great because you're not messing up with the other segments above and below. You're taking care of the problem, and you're maintaining the range of motion. So It's a great procedure.
All right, yeah, I did have an ACDF.
Right.
And it was at C5-6. And I know that there was a mark in the front. It pretty much went away. You really
Right.
can't tell. But yeah, it seemed to be a surgery that was very effective.
Right.
I didn't lose because it was one level, so I really didn't lose any, mobility.
Right.
But at the same time, I guess over the course of time, when you're saying like the disc above it and below it could suffer a little bit from that.
Correct. And talking about losing mobility, when I talk to patients about the fusion, yes, hypothetically you're losing motion. The patients will ask me, how much will I be able to look sideways and up and down? And I tell them, you're going to be better after the fusion than you are now, because your limit on moving left and right is limited by pain. If we take the pain away, you're going to be able to stretch it out and look further left and right.
And that's a very important distinguishing aspect of this, because that's one thing I wasn't expecting for you to say pain. I was expecting something structurally involved, but
No.
you're right. It's the pain.
Right. It's the pain that limits you.
Right. And that's like that with pretty much every injury.
Correct.
All right. So and that pain that comes from the neck can be quite substantial, as I've seen.
Oh, yeah. Very substantial.
And so you kind of, I guess, when you're moving, you like jump and you don't want that pain. Without the pain, you feel free to move back and forth.
Right, and if you have the pain, you're going to tend to use your shoulders to move around and look
I've
around.
seen people do that
Right,
a lot.
Right, and it's all to avoid the extra motion in the neck. But if you take the pain away, even if you have a fusion, you'll be able to stretch it without moving your shoulders.
Okay, and it's a safe surgery.
It is a very safe surgery, yes.
Because I've never seen anyone have any complications so far in 20 years from that type of surgery.
I have.
I'm sure you have. Well,
Yes.
because you probably performed a hell of a lot more than I've seen.
Yeah, but it's probably less than 1%.
Wow.
Yeah,
Okay.
The complication rate is very low.
Okay, and what about the infection rate?
Luckily, and knock on wood, with spine, the infection is hardly there. There's a lot of blood supply to the spine, and therefore people don't get infected very often at all. Unlike knee replacements or hip replacements,
Right.
we really do everything we can to avoid infection, and we do in the spine, but spines don't get infected very often at all.
I didn't know that.
Correct.
Okay,
Yeah.
and why? It's because there's more blood flow?
There's more blood flow.
Okay.
Like people that have lacerations in their scalp, there's so much blood there and they bleed a lot. They hardly get infected in their scalp wounds.
Wow, all right.
Yeah.
Well, see, that's something I didn't know.
Right.
That's something I like to have you here because I learn things. So the more blood flow, the less infection.
Correct. Yes.
Okay, so you don't see that too often in the neck surgery.
Or the lower back.
Okay, yeah, let's talk a little bit about the lower back now. Actually, a lot about the lower back because I've seen people talk about they've had cages put in, things of that nature,
Right.
lots of different types of hardware. Can you explain how you even go about doing that procedure?
There's so with the lower back, it's a little bit more complicated. Your whole body's weight comes down on your lower back, and so you try to do everything you can to minimize the trauma on the lower back. There's already the trauma from the injury, from the accident, but then you don't want additional trauma from the surgery. So the main thing to do is to do the surgery with the least trauma possible.
Sure.
And therefore, there's a lot of minimally invasive techniques where we don't cut the muscles at all. We get down to the spine through little dilators, and one dilator, and then you put a little wider one. So what you're doing, you're spreading the muscle fibers without bleeding and without cutting anything at all. Okay. And then we're working through a little small channel or a small tube that's attached to the table, and we're able to get down, do a laminectomy, take the pressure off of the nerve, do a discectomy, take the disc part that's pressing on the nerve. We're able to do all that. Even the fusions, you're putting screws that are probably 2 inches long. You put 4 of them and 2 rods. All that can be done with minimally invasive procedures.
Wow. See, to me, that I would think that if you're going to do that type of procedure, it would be a wide open back. There'd be all sorts of stuff going on. And
it used to be like that,
right.
But with personal injury, the injury is mostly limited to one segment. If it's limited to one segment, you can do that with a minimally invasive. So you're not cutting muscles. The recovery is better. The blood loss is better. Complication rate is better too.
And of course, with the back, the spine, you don't have to worry too much about the infection as well.
Correct. Especially if it's just one level.
Right. And what about a cage? What is a cage?
So the cage is used in a fusion surgery.
Okay.
It replaces the disc. If you're going to take the disc out and you're going to fuse, you have to put something back in. It's better to put something back in to give it the support. And so it's a little plastic or metal round ring. It's hollow in the middle, and that hollow segment in the middle you fill it up with bone graft, either from the patient or from the bone bank.
Okay, very good. And then you insert that.
You insert that and then stabilize everything with the screws, because you don't want wiggling, otherwise that cage is going to come out, or and it also can pinch on the nerve. So you want to stabilize everything with the screws, and then with time, over 2 or 3 months, things heal, and then you don't have to worry about it anymore.
Okay, so when you say putting screws in, it's just so different to hear putting screws in a human body,
Right.
especially in a spine.
Right.
Where do they go exactly?
They go in the pedicle. It's just part of the spinous vertebra,
Mm-hmm.
and they go into the pedicle. We do it under X-ray guidance, and so we're not, put it in a wrong position, and it stays there. Even after you heal, you don't need it anymore, but it's another surgery to take it out. So if it's not causing harm, we just leave it in.
Wow. And can people feel it? Like, do they know it's there? Can you feel the instrumentality?
Most of the time they don't, but if you have a very, very thin person, sometimes it causes discomfort, and in those cases we just take it out. If to take it out, it doesn't even take 20, 30 minutes.
Wow, that's amazing.
Yeah.
Okay, that's good to know too, because I know a lot of people, when I talk to them, especially my clients, when they say, hey, my back's really bad, I'm so afraid, I've heard horror stories about back surgeries, and that's the number one area of the body that I think that I've heard more of my clients say, hey, I'm more concerned about lower back. Everybody I know that's had lower back surgery says it's terrible, they're always worse after. I don't see that with your patients.
I hear those stories all the time, and somebody knows someone who knows another person,
Yeah.
and a distant cousin. Everybody has a horror story about spine, and it's unfortunate.
It is.
And it makes my job a little harder to convince patients that it's safe.
Right.
You don't have to worry about it.
Well, that's why we're here today, because I want all of you out there to realize that it's a different world today. The technology is so far advanced, as Doc is telling you, and you don't have to worry about the things you had to worry about many years before. So this isn't your father's and mother's surgery. This is a whole different generation
Correct.
of
Very
surgeries.
different. Yes.
Yeah, so that's good, because if you can comfort people enough to let them know we can actually fix you, help with your pain with minimal, stress and pressure and risk, boy, it would make sense to have the surgeries done
Right.
if they really need them.
Right. And the incisions now are literally this long or even shorter for the minimally invasive. If it's a disc removal, literally it's about less than an inch.
Wow.
It's the Band-Aid procedure that they used to advertise on TV. But that's all it is. And patients go home the same day, and within a week or two after, when I see them in follow-up, they're done.
Wow, that's incredible. And
Yeah.
that takes away their pain too.
Right. And sometimes they don't even have to see me again.
See, that's amazing, because when I first started practicing 20 years ago, procedures were much different, even 20 years ago.
Yes, they have been.
And I, so for me, that's one of the main reasons I wanted you here, was because I get so worried about when clients come to me. I never advise
Right.
a client to have surgery. I advise them to go to the doctor and get the best advice possible and make an informed decision.
Right.
And I'm trying to educate people now through these podcasts by letting them know Well, he's the expert. He knows. He does these surgeries, and he's telling you right now that it's not like it used to be, and it's a lot easier to have these surgeries done. And certainly, there's people out there with a lot of lower back pain, which, God, back pain is going to be the worst. The lower back pain. It's terrible.
Horrible. Yep.
And people complain constantly.
Correct. And I've been in practice over 20 years, and I've seen the changes and the technology advancements, and it's great. It's just very impressive.
And it's good for you because you get to look your patients in the eye afterwards, knowing that the technology itself that you've learned and put to work is helping them.
Right.
Wow, that's a great feeling. And I know that lately I've had a few people have had those procedures from you. Matter of fact, one of my close family friends was in terrible shape, and she came to you and you fixed her.
Right.
And she had terrible lower back pains.
Right. Correct. And the thing is, I never try to convince or talk someone into having surgery.
Right.
I let them make the decision. They'll tell me, Doc, I really need the surgery. And after the surgery, they're very happy. And their only regret is that they hadn't done it years ago.
Right. But maybe it's best they didn't. But today's medicine's different. I know that today she was in bed when she called me. She couldn't get out of bed for 3 or 4 days. The pain was that bad.
Right.
I know when she went to you, the pain was that bad.
Well, when she came to me, she couldn't even stand in the exam room. She was always laying down. She couldn't. She just couldn't.
Well, just so you know, she attended her granddaughter's soccer game.
That's
and
wonderful.
She was walking around and she was smiling.
Right.
And she was having a very, very nice day. And she was so thankful. Actually, she sent me a letter. I got to show it to you.
Okay, wonderful.
She sent me a letter that said, David, thank you so much for getting me over to Dr. Regab. He has changed my life. That's a big deal because this wasn't part of my, hey, this is my client. This was a family member, basically, that came to me in need, and I sent her to you, and you took care of her 100%. And that means more to me than anything because it's not just about money.
Right.
For me, it's not. It's about making sure people go to the right doctors and get fixed because health is everything.
Right.
And she has 3 granddaughters that she helps take care of, and she can do that again where she couldn't have done it unless you fixed her.
She was so miserable the day she came.
Yep.
I told her, you're going to need surgery, but let's do an injection first because just to get you out of this pain. And we tried the injection. I did the injection the same day, knowing I'm not going to get paid for it because we didn't get the approval from the insurance company.
Right.
But she was miserable.
Right.
And you just can't wait around for insurance companies.
Right.
And eventually she had the surgery within 2 weeks, and she was great.
Right. And they didn't bill her for that at all. That was just something that you did out of the goodness of your heart.
Well, she was miserable.
I know, but see, that's the point, though. You see, not all docs think that way.
Yeah.
And same thing with attorneys. A lot of people don't. If there's no money in it for them, they don't get involved with it, which is a shame.
Right.
But,
and when I used to be at the university, there are so many patients I treated. I know they didn't have insurance, so I knew I wasn't getting paid for them, and that's fine. It makes me feel better when they feel better.
Well, see, that's special. That's you've got a good heart, and everybody at CSI is that way, which is why we work so close together, because I want to be able to look my patients, or your patients, my clients, in the eye at the end of every case, or if I just send them over there as friends, which we've done several times, and I want them to be able to walk out of there saying, thank you, it was the right place, they took care of me, and I know you're going to do it. I just have all that trust.
Correct, yes.
It was really good, and I know that she's feeling so much better. So moving on, let's talk a little bit about thoracic. I know that that's one of those taboo subjects as far as surgery is concerned. Yes. If you describe when you would absolutely have to have the surgery, and kind of describe what you have to do.
Okay, so surgery on the neck or lower back is much more common and much more often done than the thoracic spine. And the reason is the thoracic spine hardly gets injured because you have the rib cage, and that rib cage is protecting your thoracic spine. It stabilizes it, so with whiplash, the thoracic spine is hardly ever affected. If the injury is strong enough and bad enough, it will fracture the ribs, it'll fracture the vertebra. Those need surgery. And sometimes you'll have a small disc herniation that will pinch the nerve, and the patients will have that radiating pain around the chest. Again, we try to treat them without surgery because thoracic spine surgery is because it's much less common. I think it's more risky than the cervical or the lumbar. So we try as much as we can to avoid surgery on the thoracic spine.
And if you do have to do it,
if we do have to do it, we will do it. We'll try the minimally invasive, but not everybody benefits from the minimally invasive.
Right.
If you have a big fracture, You can't do minimally invasive. You're going to have to, especially if there's like a partial spinal cord injury.
Right.
You have to go in. You have to take everything off of the spinal cord, give it the best chance to recover.
Okay, now I've heard that you have to go through the front.
Sometimes we have to go through the side.
Okay.
Take one rib out, spread them. It's a big surgery.
Well, now explain that,
And-
because I want people to understand how traumatic that is.
It is very traumatic if there's a spinal cord injury, and the bone fragments are all shattered and they're pinching on or they're pushing on the spinal cord. You want to get all the exposure that you need and to make sure that each and every bone fragment is off of the spinal cord. And so we go in from the side. One rib is taken out, and we don't throw it away. We use it for the bone graft because that person is going to have a fusion. And then we make sure there's nothing else pinching on the spinal cord. All the bone fragments are taken out, and then we put plates and screws. And you can't really determine whether this patient, how much recovery this spinal cord injury is going to have, but we do as much as we can. So the bone healing is the easy part. Recovering the spinal cord or the paralysis, that's the hard part, because we don't know who. We know if you have a partial spinal cord injury, you should recover. How much, we don't know.
Okay.
It depends on how much injury has been sustained.
And if you have to go through by taking the rib out and going in, is that something that is just required with yourself, or do you have to have other surgeons available with you?
It depends on your comfort level. I'm able to do it myself. Some people will have thoracic surgeons help them with that too.
Okay, so that's just probably the surgery that you least likely to have performed, because it's an area that's better protected too, right?
Right, and really, it really needs a hospital that's equipped for those type of procedures. So I used to do them when I used to work at the university, because there's all the support with the cardiothoracic surgeons, with the ICU, with the chest tubes. But if you go to a local hospital, I wouldn't advise you to do it in a local hospital.
Okay, very good. And of course, if you have someone comes to you like that, you'll be able to tell them that, and you'll be able to best
Yeah, I
advise
usually send
them.
them to Tampa General if needed.
Okay, and you do surgeries there?
I don't.
Okay.
I'd refer them to somebody that has privileges at Tampa General.
Because that's the safest for the individual.
Safest for the patient, yes.
See, and that's the key, is making sure that you do everything for the safety. And that's always been your first regard since I've met you.
Correct.
Which is safety in your care and concern for the patient, which is huge. I know a lot of people have gone to doctors in the past and haven't felt that way, but you just exude that care about people, which is really what attracted me as far as working with you in this respect. So I do appreciate you doing that.
Sure.
And before we go, I've got to tell the story. You've heard it, but I'm going to tell everybody else the story. I went to Egypt, and that's where you're from.
Correct.
And what a beautiful country. I mean, I know they've had some unrest. No worse in this country
Right.
recently. And and the people in Egypt might be the nicest people I've ever met in my life. I'm totally honest. When I went there, there's no, like, if you want to buy water, there's no price on the water. You have to haggle. Mm-hmm. You have to argue back and forth. They'll start at 1,000, and you got to work your way down to a number that you can live with. And I think that it's like 15 to 1 when I went there, as far as 15 of their pounds, is it?
Right.
To one of our dollars.
Correct.
So you have to kind of do that math as you're working and arguing.
Right.
But it's fun, and the people there are good-hearted about it, and they're nice. They're just so nice, and everybody I had such a great time with. So I'm there with a tour group, and we're leaving the Valley of the Kings in Queens area.
Right.
And there was a bunch of school buses lined up for what must have been just, obviously as we take kids to D.C. and show them around for their class trips, they were having a class trip, the Egyptian kids going to the Valley of the Kings in Queens. So there must have been a couple hundred kids marching up the stairs, and as we're walking, I walked to the side with my daughter, who was at the time 8 years old,
right.
blondish hair she was wearing, and we're walking down. So we exude American. I mean, we just look like,
of course,
it's like there was no hiding it, and I probably had my red, white, and blue shirt on or whatever, just stupidity, just the way it is. And so as they're approaching, all the kids started grabbing at my daughter, and I was like, oh my God, what's going on? I was trying to protect her. Right. They weren't mean, but they were just trying to touch her. And the school teacher runs up and spoke perfect English. She says, oh, sir, I'm so sorry, but they've never met an American girl. And I was shocked by that.
Yeah.
And then I started thinking about it, and there was, on our trip with 60 or 70 people that were with us in our group, she was the only kid under 20. People don't take their kids out on vacations like that, I guess. I thought it was excellent education.
Yeah.
So it turned out they wanted to take photographs with her. So she lined up for about 20 minutes and took photographs with all those kids, and she felt like a rock star for 20 minutes. and the reason I say that is because they're just good people from Egypt, and you hear a bunch of different things, but what a great country, and I hope things get back to a point where we can visit again there.
Yeah, I hope so too. They're good-hearted people, and they have a great sense of humor.
Yeah.
And it's fun. It's
awesome.
Really fun. Yeah.
All right. Well, thank you very much, Doc, and I do appreciate it. And we'll be back for more on the Personal Injury Guru Show.
Thank you.
Back to the Personal Injury Guru. And I would like to say that talking to Dr. Regab today, who you can always find at CSI, Comprehensive Spine Institute on Gulf Bay and Clearwater, they will be happy to help you in any way possible. And you can rest assured, I send my family and friends there. I'm a patient there, and I can tell you that they do an excellent job with everything from the surgical procedures to the care to the friendliness at the front desk. It's a great place to go. And the reason I wanted Dr. Regab to come back today was I wanted to get a little bit more detailed about the surgical procedures. And I think it's important for you to know how safe they are now and what the technology has done for each and every one of you now, where these docs can come along and they can make your experience so much easier. And again, he's been practicing and doing surgeries for 20 years, and he has seen all the results change. He has seen all the people have an easier time with these surgeries, and the technology is worth looking into because so many people had terrible stories, like the doc said about, somebody knows a friend or family member that's had a horrible back surgery. Those days are over. Go to the people that are on the cutting edge of technology, which is at CSI. You can get fixed. You'll feel a hell of a lot better. And you know what? There's no reason to be in pain anymore. You can get fixed without the complications. And that is huge because I've had personal family friends that have come back from that place and they have just raved. And I think it's very important. So if you're listening and you like this particular show or any of my shows, make sure that you hit like, make sure you follow it, make comments if you feel it necessary, and I'll always respond to you, and also subscribe. It's very important if you're listening on one of the platforms or just to hear the verbal platforms, you can do that. But remember, we're on YouTube, and you can also go to YouTube and see us live on the YouTube, and you can also watch us on these videos, and you can see us sitting here talking like regular people like we are. So make sure you check it out. You can go to www.dpapainjurylawyer.com. You can just Google Papa Injury Law and you'll find me. So it's easy enough. My phone number is 727-500-LAWS, LAWS. And anytime you contact me, I'll be more than happy to help you guys out. And if you have an idea about the show or maybe you want to be on the show, just give me a ring. Anyways, thank you very much. And again, the show was an excellent show today. I appreciate Dr. Regab. And with that, the Personal Injury Guru show is over for right now, but we will be back with more shows. Thank you.